crooked, curving, angulated slash kinking, looping, and or spiral twisting veins are also called. A. Bad veins. B. Tortuous veins. C. Thrombotic veins. D. Sclerose de vein. The correct answer is B. Tortuous veins. Choose the adjective that does not describe hospital-associated infections, HAIs, that occurred during the height of the COVID-19 pandemic. A. Limited. B. Preventable. C. Expensive. D. Common. The correct answer is A. Limited. Precautions related to airborne pathogens require the phlebotomist wear. A. An N95 respirator. B. A mask. C. A gown. D. Eye protection. The correct answer is B. A mask. Which infection listed below has the highest prevalence of nosocomial infection in the acute hospital settings? A. Urinary tract infections. B. Dermal infections. C. Pneumonia. D. Wundinfection. The correct answer is C. Pneumonia. Gloves are worn to A. Prevent contamination of hands when handling blood or body fluids. B. Reduce the chance of transmitting microorganisms on the hands of personnel to patients during invasive procedures. C. Minimize the possibility of transmitting infectious microorganisms from one patient to another. D. All of the above. The correct answer is D. All of the above. Which of the following statements refers to the main purpose of a hospital's infection control program? A. To determine the initial source of communicable infections. B. To protect patients from all outside contaminations. C. To isolate infectious patients from others who may carry infection. D. To prevent the spread of infection in the hospital. The correct answer is D. To prevent the spread of infection in the hospital. When drawing for blood cultures and other labs for an adult, the phlebotomist ensures that A. The patient is on antibiotic therapy. B. They perform a dermal puncture. C. Blood culture draws are collected first. D. 1 to 3 cubic centimeters is collected. The correct answer is C. Blood culture draws are collected first. Which of the following is not an example of a possible parenteral means of transmission? A. Rubbing an eye with a hand that is contaminated. B. Touching infectious material with your chapped hand or hands. C. Drinking water that is contaminated. D. Getting stuck from a needle previously used on a patient who has AIDS. The correct answer is C. Drinking water that is contaminated. Which is not included as a step in hand hygiene procedure. A. Stand back from the sink so that clothing does not touch it. B. Dry your hand with a paper towel and then use it to turn off the faucet. C. Wet hands and then lather with soap and wash the hand for at least 15 seconds. D. Dry hands thoroughly using a clean disposable towel. The correct answer is B. Dry your hands with a paper towel and then use it to turn off the faucet. What is the organization overseeing the control and investigation of various diseases, particularly communicable diseases? A. Health Resources and Services Administration, HRSA. B. Centers for Disease Control and Prevention, CDC. C. Occupational Safety and Health Administration, OSHA. D. Food and Drug Administration, FDA. The correct answer is B. Centers for Disease Control and Prevention, CDC. Choose the example of an engineering control that helps eliminate hazards posed by bloodborne pathogens. A. Labeling. B. Lab coat. C. Sharps container. D. Hand washing. The correct answer is C. Sharps container. Choose the two organizations responsible for the latest guidelines for isolation precautions in hospitals. A. Centers for Disease Control and Prevention, CDC, and Hospital Infection Control Practices Advisory Committee, HICPAC. B. Centers for Disease Control and Prevention, CDC, and Occupational Safety and Health Administration, OSHA. C. Hospital Infection Control Practices Advisory Committee, HICPAC, and National Institute for Occupational Safety and Health, NIOSH. D. The National Institute for Occupational Safety and Health, NIOSH, and Joint Commission on Accreditation of Healthcare Organizations, CAHO. The correct answer is A. Centers for Disease Control and Prevention, CDC, and Hospital Infection Control Practices Advisory Committee, HICPAC. Under CDC isolation guidelines, the old categories of isolation and disease-specific precautions have been collapsed into three sets of precautions that include A. Airborne, droplet, and contact. B. Airborne, respiratory, and contact. C. Enteric, contact, and respiratory. D. Complete, droplet, and airborne. The correct answer is A. Airborne, droplet, and contact. Regarding a host's susceptibility in the chain of infection, what factor increases susceptibility? A. Using any disposable equipment. B. A shot for immunization. C. Using drugs. D. Good nutrition and eating habits. The correct answer is C. Using drugs. All of the following can be transmitted through blood transfusion except A. Diabetes mellitus. B. Hepatitis B virus, HBV. C. Human immunodeficiency virus, HIV. D. Syphilis. The correct answer is A. Diabetes mellitus. What precautions do you use for a patient who has an enteric pathogen? A. Airborne. B. Contact. C. Droplet. D. Standard. The correct answer is B. Contact. When following bloodstream infection, BSI, protocol, what is the proper way to dispose of lab specimens and contaminated supplies that are not sharps? A. Place specimens and contaminated supplies in an outside trash receptacle. B. Carefully set specimens and contaminated supplies into 2 bags for removal later. C. Wear gloves, only touch infectious waste, and discard materials into a waste bag. D. Wear gloves, minimize contact, and discard waste into marked infectious waste bags. The correct answer is D. Wear gloves, minimize contact, and discard waste into marked infectious waste bags. When putting on protective gear, what is the proper order? A. Mask first, gown second, and gloves third. B. Gloves first, gown second, mask third, and eye protection last. C. Gown first, gloves second, eye protection third, and mask last. D. Gown first, mask second, eye protection third, and gloves last. The correct answer is D. Gown first, mask second, eye protection third, and gloves last. When wearing a gown, CDC's infection control guidelines recommend all of the following except A. Wear a gown for direct patient contact when the patient has uncontained secretions or excretions. B. Do not reuse gowns, even for repeated contact with the same patient. C. After leaving the patient's environment, remove the gown and perform hand hygiene. D. Remove the gown and perform hand hygiene when leaving the patient. The correct answer is C. After leaving the patient's environment, remove the gown and perform hand hygiene. Infection control education and training recommends all of the following except A. Job or task-specific education. B. Enhance education and training for patients and visitors using PhD level language so they may better understand their healthcare professionals. C. Information concerning use of vaccines as an adjunctive infection control measure. D. Enhance education and training by using online educational tools available to the institution. The correct answer is B. Enhance education and training for patients and visitors using PhD level language so they may better understand their healthcare professionals.